Hey there, welcome back to How to Medicate, and as you might have guessed from the title and the thumbnail, today we will be discussing PTSD, also known as post-traumatic stress disorder. We will discover exactly what it is, some tips and tricks for dealing with it, and I will discuss a proper treatment plan for you to talk over with your doctor. Now, for those of you I'm meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands, and I'm making weekly medical videos to educate myself as well as you, my viewer. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and when looking for medical advice, always contact your own doctor. And lastly, for those of you that can't get enough after this video, check out the playlist in the description with more fantastic medical videos. Now let's get started. Now, as my regular viewers will know, I start these videos off by exactly explaining the topic of the video, in this case PTSD. And I start by Googling it. And when Googling it, you find the following definition. Post-traumatic stress disorder, PTSD, is a mental health condition that is triggered by terrifying events, either experiencing it or witnessing it. In the DSM-5 on the other hand, the most used diagnostic manual for mental health disorders, PTSD is quite a complex diagnosis. In order to diagnose someone with PTSD, a person must have at least the following symptoms for more than a month. At least one re-experiencing symptom, like flashbacks or nightmares. At least one avoidance symptom, like avoiding some places, events or objects, which are reminders of the traumatic experience, or avoiding feelings or thoughts related to the traumatic events. At least two arousal or reactivity symptoms, like difficulty sleeping, angry outbursts, feeling tense, or being easily startled. And lastly, at least two cognition or mood symptoms, like loss of interest in enjoyable activities, feelings of guilt, or negative thoughts. And now you might wonder, how is PTSD caused? Anyone can develop it at any age after experiencing serious trauma. According to the National Center for PTSD, about 7 to 8 out of every 100 people will experience PTSD at some point in their lives. However, the majority of people experiencing serious trauma will not develop PTSD. If it does develop, it will most commonly do so within 3 months after experiencing the trauma, and only in rare cases it will develop in later stages of your life. Now, there are many factors which can contribute to a person developing PTSD. There are risk factors which can increase your risk, and there are certain protective factors which can decrease your risk. Important risk factors are experiencing serious events or traumas, getting hurt, seeing another person get hurt, childhood trauma, feeling extreme helplessness or extreme fear, having little or no social support after a traumatic event, and having a history of mental illnesses or substance abuse. Important protective factors are certain genetic and neurobiological factors, having plenty of social support, finding a support group, having a protective coping strategy, and being able to act and respond effectively despite feelings of fear. Which brings us to the treatment of PTSD. And here I want to mention that if you recently experienced serious trauma, or if you experienced any of the symptoms previously mentioned in this video, always discuss this with your personal doctor. He or she can help you to find out the extent of your symptoms and may explore any underlying causes, provide you with tips and tricks, and if needed, set up a treatment plan. Your doctor might do this by asking exactly about your current symptoms, exploring your medical history, and afterwards doing physical examination or some blood tests to rule out any other underlying conditions. If necessary, your doctor could also refer you to a mental health professional, depending on the underlying problem and causes, as getting treatment as soon as possible can help prevent PTSD symptoms from worsening. Unfortunately, overcoming PTSD can be quite challenging. Therefore, you must be in the best shape possible, physically but also mentally, and you do this by some proper self-care. Try to get at least 7 to 9 hours of sleep each night. Maintain a structured sleeping schedule, eat enough vegetables and vitamins, drink about 2 liters of water each day, try to exercise regularly, and maintain regular contacts with your loved ones. Now, if your doctor deems therapy necessary, there are 2 main treatment options: talk therapy, also known as psychotherapy, and the usage of drugs or medication. And here it is important to note that people are different, and finding the right drug or the right therapy that works for you can be quite a process of trial and error. One of the key elements here is finding a mental health professional with experience in treating PTSD and with which you also feel very comfortable. When treating PTSD with medication, doctors most commonly use antidepressants. These can reduce symptoms of sadness, worry, anger, and feeling numb inside. These might also improve sleeping problems or concentration problems. Examples of commonly used antidepressants are paroxetine and sertraline. In addition, doctors also prescribe anti-anxiety medication when someone experiences severe anxiety. Which brings us to psychotherapy. This can be followed individually or in group setting. In psychotherapy, the underlying psychological problems and the trauma are addressed, with the aim to overcome it. This therapy usually lasts 6 to 12 weeks, but it can last longer if necessary. There are many types of effective psychotherapy, but most commonly cognitive behavioral therapy or EMDR are used. Cognitive behavioral therapy aims to help you by managing problems by changing the way you think and act. It uses a range of psychological techniques to help you come to terms with a traumatic event. EMDR stands for Eye Movement Desensitization Reprocessing. It involves recalling the traumatic experience in detail while making eye movements, usually by following the movement of a therapist's finger. It's not clear how EMDR works, but it can improve traumatic experiences. Now, I hope this video was helpful and I hope I gave you some useful tools to discuss with your own doctor. For those of you that want to keep on learning, check out the playlist in the description with more mental health videos. And all that rests me is to thank you all for watching. If you did learn something, please leave a like. This will help out the channel tremendously, and consider subscribing. I'm trying to reach 100,000 subscribers before the end of the year, and you can help me reach that goal, and in return you will never miss such an awesome medical video ever again. All that rests me now is to thank my sponsors on Patreon. Thank you Sebastian, who's an InvestorT supporter. All of you, thanks again. And for those of you that can't get enough, check out my Instagram account @howtomedicate. And once again, this is the second video I took with this nice new neon sign. I think it's awesome. Thank you all for watching. I will see you next week with a new video. Bye bye.